Hi, my name is Mikayla, and I am the daughter of Professor T, and I have type 1 diabetes. I was diagnosed March 20th, 2011, so I've had it for 8 years, and it will be 9 soon. And so instead of checking my blood sugar with a regular glucometer, which I have, I use a CGM, which is a continuous glucose monitor. The brand I use is Dexcom, which is on my arm, but you can't see because I'm sure. But it connects to my phone, so the blood
so let's see
sugar
what's happening now.
shows up on my phone, and also connects to my parents' phone so they can view it even when they're not with me, like when I'm at school. To take insulin, I have an insulin pump instead of shots. That's what mine looks like. And it has built-in carb ratios where it divides the amount of carbs by a certain number to give insulin. And then it also has basals, which is hourly insulin doses that it manually gives. And
we program all those,
yeah.
The basal and the bolus.
Yes. When you need insulin when you eat food, or when you're high, which is hyperglycemia, and the symptoms of that is what I get dry mouth and thirsty and headaches. Those are mostly what I get. And then hypoglycemia is low blood sugar, and that symptoms are like shaky and dizzy, hungry, really weak feeling. And if you are have low blood sugar, then you have to eat or take any fast acting glucose, so sugar, and you want to have 15 grams of it. So usually this is a 4-ounce juice box, or 4 ounces of juice, or
how many glucose tabs?
3.
3 glucose tabs.
3 is 12, or 4 is
16
yeah,
grams.
but usually 3.
So 3 glucose tabs, okay.
Or sometimes just candy, but not a lot, just a little bit. Or applesauce, or a fruit bar. But usually I just stick with juice or glucose tabs. And then you wait 15 minutes, because it's the rule of 15, so 15 and 15. And then you check again, or just look at your Dexcom and make sure your blood sugar has gone up.
And I have a question, Mikayla. At what level are you treating for hypoglycemia?
Usually under 70, but if you have symptoms and you're under 80 or 80, you can take usually I'll take 1 or 2 glucose tabs, just so it kind of goes up, especially if I'm in class and I feel low and I'm 70 or 80, I have 1 or 2 glucose tabs.
Okay, that's good for the nurses to know. What do you do if you're experience hyperglycemia?
Take insulin.
So take insulin. And what happens if your pump fails?
A shot.
So you have to take an injection, right?
Yes.
Okay. And then why don't you give the nurses a little bit of information about carb counting?
So there's basically one carb choice is 15 grams. And so that would be a piece of bread, or a medium average sized fruit, if you have an apple or an orange. And also for vegetables, the non-starchy vegetables some people don't count for them. I usually give 5 carbs for a cup, but sometimes people don't count 5, usually 5. And then starchy ones corn, or
squash, sweet potatoes.
Is 15 for half.
Yeah, regular
cup.
Potatoes. So those are your starchy vegetables. Yeah. Why don't we talk about the bananas and grapes, because those are important.
A medium one is 7.
A medium
banana.
A medium banana. So the ones you get at Costco tend to be large, right?
So 22.
Yeah, those are 22.
Okay.
So typically we do 4 inches,
yeah,
right?
4 inches.
So that's probably about 2/3 of it. So 4 inches would be how many carbs for that banana? it would be 15, right?
Oh, okay.
And then the larger bananas, 22.
I don't eat bananas.
And talk about grapes, because I think that's
grapes.
tricky.
It usually like average size grapes. It's 15 carbs for 17 of them. But like sometimes there's like large grapes, and those we do like 15 for 15.
Right.
But usually 17 for 15. But if anything has like a nutrition label on it, just read that. But like this is like for stuff if you like don't have any.
Right, like for produce, fruits and vegetables. What else has carbs in the fruit groups?
Everything. Oh, food groups?
Food groups.
Oh, I think I said fruit. Dairy, like not cheese, but like milk for 8 ounces is like 12 or 15 carbs. Chocolate milk, 4 ounces is like 13.
Okay.
It depends on the brand, but usually it's like around.
And then what about like protein foods?
Chicken, like meats don't have carbs in them.
Okay.
Or eggs.
Okay. And what about fats?
Like spreads and stuff.
Like mayonnaise and butter.
Yeah. Usually, like for butter, I don't give anything. But like, for like dressing, sometimes like a few carbs, not a lot though. Or like maple syrup, like I have sugar free and it still has like 8 carbs. Or like I can't have peanut butter, but like sun butter has like 8 carbs for like 1 or 2 tablespoons. And also, like cream cheese, I usually don't give anything, but like the Panera cream cheese has it's like higher carbs. It's like 7 for the whole container.
Right. Okay. Great. Is there anything else that you would like to know the RN students to know about in terms of type 1 diabetes?
No, I don't think so.
Okay, you did a great job. Thanks for helping us, Mikayla.
Yep.
Bye-bye.